HIV/AIDS. Two, how many facilities have the capacity to do that, so that it will help government to plan. It will help the state government specifically to plan on how to intervene. Now, we also looked at how pregnant women, when they go to facilities during the antenatal, do they receive tetanus injections during pregnancy? When they go for labor, how many women actually attend the primary care facilities? We assessed all that. The women, after arriving, what procedures do they follow? Again, most importantly, we also looked at the major causes of maternal and newborn in Nigeria. We assessed that directly. How did you assess that? We assessed the competence of the human resource in the facility. Are they able to diagnose or to easily pick up the early danger signs? For example, in a woman, antepartum hemorrhage; in a woman, birth asphyxia; in the baby after delivery, or children under 5 years. We look at severe diarrhea with dehydration, look at malaria with anemia, look at another major cause of mortality among children is pneumonia. Whether the human resource in the facility, in all our PHC facilities, are able to actually diagnose and treat children with malaria, with pneumonia.
That brings me to this. I mean, you mentioned that diagnostic inaccuracies is one of the major problems. You know, so how serious is this?
Yes, the survey actually opened our eyes. One, we categorize the health workers in the facilities. Therefore, the survey made us now understand clearly that the bulk of healthcare workers at the primary healthcare centers in Nigeria are the community health extension workers. In fact, what the survey shows us is that over 70% of the healthcare workers in the PHC in Nigeria are community health extension workers. Now, by the time you aggregate that, and you now look at the clinical competence, ability to make diagnosis of these danger signs or killer diseases, you now find that Nigeria is doing very poorly. But if you disaggregate into profession, of course there are some facilities, even from the survey, where you had medical doctors. You now see that the ability of the doctors to make such diagnosis over 60 to 70%, which is a true reflection, really, because the doctors naturally have capacity to make such diagnosis, followed by nurses and midwives, and then the community health extension workers. Now, what the survey has told us now to do is, look, since we have this huge number of community health extension workers in the country, what should we do as a country? Should we post doctors? Do we have enough doctors to be posted to primary health care centers? In the interim, if yes, but in the interim, since we have these community health extension workers that are called CHUs and JCHUs, what we should do now is to train them more, give them more training on management of women during antenatal, delivery, and children under 5. So
it's not just facility right now, it has to do with even the professionals.
Absolutely. You know, the facility, what makes a facility are the human resource. You can build beautiful structures, you can have all the equipments. If the human resource don't have the capacity, you are not going to deliver any service. And that was why we picked that, in fact, as the #1 indicator.
So let's understand now the state of PHCs across the country, because, I mean, PHCs primarily are established to really, one of the reasons is to reduce mortality rate, you know, child mortality, or, you know, and so on and so forth. But again, the president mentioned very recently, this year, as a matter of fact, that it will concentrate on PHCs, the revitalization of PHCs. So what was really your observation, you know, the true state of, you know, the PHCs across the areas you visited?
Now, the truth of the matter is that overall, our performance is suboptimal in terms of infrastructure, in terms of equipment. When we talk about equipment here, we're talking about basic equipment. Thermometers, blood pressure equipment, torchlights, and basic equipment that you require for mothers to be delivered, pregnant women to be delivered in the facility. We did not have the, we are just having about 50 to 60% of facilities actually have that nationwide. So what it has informed us now is, even our facilities in the revitalization process, we should concentrate on providing equipment to those facilities. That's one. Two, we looked at the availability of vaccines and vaccine commodities, i.e. the cold chains, refrigerators, and other appliances that you require in the management of vaccines in the facilities. That also, the survey showed us clearly that they are not enough. Therefore, the Mr. President's revitalization program is actually apt that now we have data to support what the government is doing, that we are already addressing the problems even before we even had the science of the research actually brought them out. We also look at family planning. You know, whether we like it or not, in the country, our fertility rate is very high in Nigeria. And if that is the case, how do we bring that under control? We are not saying women must do what they call family planning not to give birth. No, we're talking about child spacing here. Therefore, government has made concerted effort towards procuring large quantities of family planning commodities. But what we did in the survey is to tell us, are these commodities going to the facilities? Two, not just in the facilities, are they being utilized by the women? But what we have seen is that we're only procuring the commodities in Abuja. They are not getting to the facilities.
How come?
Now, as a government, and that's what we're looking at now, that you see, that's the beauty. That's why the Honorable Minister is very happy with the survey. That look, it has now showed us that clearly we have to look at our supply chain management system.
Who really was responsible for getting this across to the rural people?
Now we have a system in the country, you know, whereby commodities are bought centrally and are distributed around the country to all the states. The drugs, when they arrive, they are kept in a central store in Lagos, in Oshodi, and that each state is supposed to come and take charge of her own drugs. But what we have seen clearly now is that either some states are not taking the drugs, or they're taking the drugs and they're not distributing to the facilities.
You say some states are not taking the drugs?
That's what it's telling us. That's what the survey is telling us. We'll now go further. You know, the essence of surveys is that it will give you an indication what is going on. So what we are going to do as next steps, in each survey, you identify a problem, then you have to now go further.
What did you see that suggested that states might not just be, you know, getting access to their drugs?
Because we know from Abuja level, Federal Ministry of Health, we are constantly buying FP commodities in large quantities in collaboration with UNFPA. That is for sure. And if we have done an assessment of the requirement of FP commodities in the country, and the government has made that concerted effort, providing that huge resources to buy, and we are also sure that the drugs actually arrive in Nigeria, and we are also sure that drugs have been distributed by the Federal Ministry of Health, and now we conducted surveys at the facility, and we're not seeing enough commodities. Are
you saying the government really did not have any any mechanism to monitor these things?
The government has excellent machinery in place.
And so?
What it means is that something is wrong at the lower level. And that is why we in the federal government are saying, we are the chief health officers, as Minister of Health, chief health officer of the Federation. But some people are the ones that own those facilities. Some people are the ones that are recruiting those healthcare workers. So many issues one can adduce from that, but we'll get to the bottom of it.
All right, hold on with your thoughts. We're still with the program coordinator of the Save 1 Million Lives, Dr. Ibrahim Kana. Join us again after the break for more.